This is All India Radio. In the program Spotlight, now we bring you a discussion on Prime Minister's post-budget webinar on health and medical research. The participants are Dr. N.K. Arora, Chairman of the COVID-19 Working Group of National Technical Advisory Group on Immunization, and Gaura Dhawanlal, AIR Correspondent. Dr. Arora, welcome to the program. Recently, the Prime Minister's post-budget webinar on health and medical research took place, which is a part of a series of 12 post-budget webinars, and this is the 9th in the series to seek ideas and suggestions for effective implementation of the initiatives announced in the Union Budget. When we take view of the webinar, Dr. Arora, what do you think is something which is actually transformational for the healthcare sector which was spoken about? The single thing that stands out. Of course, we'll go into the others also.
I think the most important point I picked up from Prime Minister's webinar is that today health is considered part of development, and the budget is made with a long-term vision, one. Number two, that it is just not announcement of some commitment, but these commitments are to be fulfilled. So when Prime Minister and the country says affordable care, then whatever is linked with that affordable care is to be taken and thought through in a comprehensive manner. So be it Ayushman card, be it Jan Aushadhi Kendras, but equally important is affordable diagnostic availability of diagnostics, availability high quality nurses and doctors, and availability of the overall healthcare ecosystem where you feel comfortable and you are given the best possible treatment.
Absolutely. And this actually is, I think, a much delayed but absolutely revolutionary step which is required, because we keep talking about accessibility, last mile delivery, and even Mahatma Gandhi spoke about we do not grow or develop till the last person, the Antyodaya, is looked after. And here we're talking about how, at least even if it starts with the trickle, because we are a huge population, the trickle down of good medical accessibility is going down. And keeping all this in mind, we, earlier used to think it's roti, kapra and makan, but definitely health. We used to say that one illness in the family can completely bleed out 2-3 generations in terms of debt, in terms of, getting steeped in poverty. So what you're saying really will change how the future generations actually live their lives also.
I think COVID has been a blessing in disguise. It was a tragedy which was translated into an opportunity by the country. We realized where are the gaps and where investments are to be made so that we fulfill this dream. I will give you one example. In April 2020 itself, we knew that vaccines would be required. But how to deliver vaccine, for example, in remote areas of Arunachal Pradesh. And research projects were done to see that the delivery of vaccine can be done through drones in those remote areas. And actually this was practiced.
Okay.
So what we are now talking about, a healthcare system which has not only volume, but it has value also. Then research and development has to be at the forefront. Without research and development, we cannot achieve that. And this has been very eloquently brought about today in Honorable Prime Minister's webinar. Research and development is emerging as a very important component, and this requires a very concerted effort where collaboration is very important, collaboration with academia and industry, collaboration between national and international experts.
Dr. Arora, in terms of how we see localization of whether it's developing a vaccine or whether it is treatment or certain checks and balances in terms of a population, because Asian population responds differently, the European population, so we are genetically different also. And India spearheading research and development within the country, it is going to have large regional benefits in terms of the Southeast Asia?
There are some generic or which are more kind of applicable more generally in global sense, but local and very context-specific solutions both have to be worked together. So it is not only genetics, but there are other issues as well. And therefore, India has the advantage that we have a wide heterogeneity of context available, social context, genetic or region and ethnic context, and then geographical heterogeneity or variation across the country is there.
Right.
And if we are able to address these within whatever with a focused manner, then we are able to find solutions which are applicable not only to our country, but to our region and globally also. Vaccine is a very good example. When COVID started, we were basically a vaccine contract manufacturer. We were not developing or doing new R&D for vaccines. But during this 1.5 years, the way high-risk investments were done for infrastructure creation, similarly investments were done for new R&D for vaccines, bringing partners, collaborators together. Today we have 7 platforms to manufacture COVID vaccines, but these platforms will be available for other vaccines also. Even for veterinary vaccines, the same platforms can be used. So this is one example. On the other hand, we need antiviral drugs. We need devices which are low cost, but as qualitatively as good as anywhere they can be. So we have this whole opportunity. The canvas is open, but the key issue is that policy-wise, are we ready? And I see that opening up of that policy. Pharma sector, which is currently 4 lakh crores, can be, as I heard, has the potential to become 10 lakh crores. And the objective is that we have skilled manpower. We need to be confident of ourselves. Second is we have to bring greater trust between public sector and private sector, academia and industry, so that they can work together and make this as a sunshine industry.
Because all this, and you're so right, sir, has social and commercial viability and validity. Because if India, as you're saying, we have such a diverse population, such a diverse gene pool, great place for research and development. And what comes out from here is applicable in so many ways. A great business opportunity also for India while delivering health.
I will give you another immediate example and which takes care of the issue which you are raising.
Right.
India established one of the largest network of genomic surveillance, and we were able to pick up virus from all over the country. Now, this is a great capacity established in the country. It's a very rare and very cutting-edge technology, but established in 58 institutions across the country. Now, this is to be harnessed on one side for building skilled manpower. The second is that the same capacity can be used for developing precision medicine, as you are talking about, because genomic sequencing and accordingly respond to the diseases, because we have this infrastructure which has come up recently, and this is to be harnessed. And I see a very clear-cut thinking process in the policy framework.
Dr. Arora, we spoke of actually populating the country with medical facilities, and we're also looking at training manpower. The health services in the health sciences, changes are happening at a very rapid pace. Do you think we need to have a more adaptive curriculum also for the various institutions that teach related departments?
We all need to harmonize ourselves, the skills of the manpower, the training structures with the rest of the world. Because if we want to follow this whole philosophy of heal in India and heal by India, our manpower is not only working here, but we are also a provider of trained manpower to the rest of the world. Then this harmonization process is very important, so that our training curriculums are in harmony and in sync with the rest of the world. In fact, we should be leading those curriculum development. Second component is skilled manpower in terms of cutting-edge technology, R&D sector, which is a different ball game. And for that, India has to have the confidence. And COVID has shown us that we can do it. As I said, I talked about vaccines. Similarly, for devices and diagnostics also, we were very quickly able to indigenize, and under Atmanirbhar program, we had kits for diagnosis of COVID, ventilators were manufactured, these PPE kits and all the masks were manufactured here. So that is a different kind of a skill set, and for that institutions are required and collaborations are required. And that means not only health sector institutions, but IITs have to come in place. The institutions which are involved with technology users, they need to come up, because IT is a very important component, and other technologies. So unless there is collaboration between health sector institutions and non-health sector institutions and industries, they come together, we will not be able to have skilled manpower to cater to our requirement.
Dr. Arora, I think you're also talking about how this comes together when they collaborate together is about responsiveness. Coming to the time within which we have responded, and I think COVID has been a brilliant example,
When we talk of we call it jugaad, but more than jugaad, I think the creativity which has been shown and how small people, small companies have come together and responded, and that's shown great flexibility and elasticity in the country and our intellectual wealth also. When we come to the result, are we also addressing, when we talk of holistic health, the causative factors, whether it's communicable, non-communicable, accidents, injuries?
The point you are raising is 2 points. On one side, in fact, jugaad is actually not jugaad. I would say it's a great form of innovation.
Absolutely.
That you get the things done. And we should be proud. The whole issue is to institutionalize this process of jugaad.
Okay.
To document these processes so that they become mother for next innovations also.
Well said.
The second thing is collaboration. Collaboration is absolutely important. If we want to be a developed country, and any country which has developed is become developed country, collaboration is the key. Collaboration is easier said than done. It requires accommodating each other and also learning and leveraging on each other's strengths and complementing each other's weaknesses. And this is an ongoing process. And faster we do it and more we do it, better and closer to being a developed country we will be. So collaboration is key. And you're right that on one side we have to provide clinical care, which is time consuming, and we would not like to divert too much of our doctors' time or health professionals' time from clinical care, but simultaneously their wisdom, their thinking process, their challenges are required, and there should be other sectors who are full-time researchers, whether in research institutions or engineering institutions, they need to work together. We have shown that we can do it. We have the confidence, we have the brilliance, we can do it. But the more we do it, better results in a shorter time, more efficient manner, it will become visible.
Towards the beginning of the program, Dr. Arora, you had shared that health is a critical pillar of growth and development. Coming to job creation, that is also going to actually get hugely benefited. We are going to get more jobs, and technical and qualified job creation. Do you think that's also going to happen?
There are very wide kind of guesses that as far as health sector is concerned, anywhere up to 50 to 100 million jobs can be created. And it has the potential. So jobs are at various levels. So we are not just only talking about doctors, nurses, or scientists, the technical people, but we are also talking about paramedical staff which supports. So simple lab technicians, the ward attendants, those who provide physiotherapy and nutritionists. So there is a huge list. There is, I think, 54 streams which are associated, which are called allied health services. And job creation is a huge potential. And this job creation is not only for our country. In fact, rest of the world is kind of very hungry for this kind of need for skilled people. And therefore, this whole sector, while it will support the quality and improving the quality of healthcare within the country, I think skill building, when it is taken in a campaign mode or in a focused manner, it will provide manpower for the other parts of the world. So huge job creator sector.
I think your statement that it will provide skilled manpower to the other parts of the world is very, very powerful, because we are looking at reaping a demographic dividend. We're also looking at, our human resource is our potential. And for this dividend to remain a dividend and not become a liability, I think the quality of education, the importance going into the field of education, the importance going and saying, okay, let's find cutting edge, let's put in research, all that is really going to help the whole pool, the pool of skilled labor available across the world. That's a powerful statement.
I would like to add, and that is why I made this statement, that harmonization of our curriculum with the rest of the world is also important, so that our skilled manpower is acceptable, not only acceptable, desired.
And that will help us improve our quality also. It will give us a larger vision of the world. And, we're looking at becoming global power, and this is going to go a long way, because we do have soft power, as you said.
Yes, we are not only looking after our population and harnessing our demographic dividend and improving the economics of this whole sector and economics of the country in this process.
Well said, Dr. Arora, and I think a great summarization of what we've discussed today. Dr. Arora, thank you so much for joining us.
Thank you very much, Gaurav.
You were listening to a discussion on Prime Minister's post-budget webinar on health and medical research. The participants were Dr. N.K. Arora, Chairman of COVID-19 Working Group of National Technical Advisory Group on Immunization, and Gaura Dhawanlal, AIR Correspondent. This program was produced and presented by the News Services Division of All India Radio.